Hello everyone, welcome to Comcast Newsmakers. I'm Barbara Rodgers. Joining me in the studio now is Barbara Brooks. She is a board member, or actually, yes, a board member, not the chair of the board, right?
No.
Board member for LifeLong Medical Care.
Roberta.
Okay.
Roberta Brooks.
I'm sorry. Did I call you Deborah?
Deborah.
Hello everyone and welcome to another edition of Comcast Newsmakers. I'm Barbara Rodgers. Joining me in the studio is Roberta Brooks. She is on the board of directors of LifeLong Medical, and thanks for stopping by today to talk about LifeLong Medical.
My pleasure. Thanks for having me.
LifeLong has been around for about 36
years.
How did it get started?
It got started in Berkeley in 1976 when a group of Gray Panthers realized the enormous need for the elderly and elder care. And there really was nothing like what they started, which was called the Over 60 Clinic. It started then, and then in the 90s it merged with another clinic in Berkeley called Primary Care Access Clinic, and that formed LifeLong Medical Care. Now there are clinics, 3 in Oakland, 3 in Berkeley, a dental clinic in Berkeley, a number of supportive health services in low-income apartment buildings. We've just opened 2 clinics in West Oakland schools and a new clinic in Richmond.
So it's no longer just for senior citizens?
No, it's for everybody.
What exactly does it do?
It provides primary care to anybody, regardless of whether or not they have health insurance. It is part of the major safety net in this country, and it is the safety net in Berkeley because Berkeley has its own public health department, and in all of Alameda County where it serves, as well as we have an adult day health center in Marin County and now in Contra Costa County in Richmond. It provides primary care, it is complete services, there's mental health services, psychosocial services, nutrition, health education, prevention. It is really a wonderful organization.
Healthcare is, there's such a debate about healthcare going on in this country.
Yes.
One of the big debates is how do we pay for it? How do you pay for this?
Well, most of our reimbursement, we are a federally qualified health center, and therefore we get a higher reimbursement for Medi-Cal, which is Medicaid nationally, and Medicare. Those are the folks that are covered. We also accept people, of course, with private health insurance, the Alameda Alliance, which is a health insurance managed care program in Alameda County, and grants. I mean, we raise as much money as we can to be able to provide services to many folks who do not have any insurance at all.
In fact, you have a fundraiser coming up.
We do. In March 3rd at Hs Lordships in Berkeley, we have our annual fundraiser. It's called Crab and Cocktails. It's a very fun event. And we're thrilled this year that our honorary host is Rita Moreno. And as you may know, she's one of the people that got the Grand Slam, they call it, because she got an Emmy, a Grammy, an Oscar, and a Tony.
Yeah.
So she's very supportive of our work, and we're thrilled to have her.
And you also have a capital campaign going on?
We do. I'm chairing a capital campaign for the West Berkeley Family Practice, and that is in a historic building in Berkeley that we received some stimulus money to restore the historic part, and we're going to be building a brand new clinic, and it will double, it'll increase our ability to serve over 3,000 more patients. We now serve about 6,500, and we will be serving about 9,500 patients. And it's going to be designed in such a way to reflect the way lifelong medical care does its care, which is a very holistic way, so that if a person has mental health problems, there'll be a mental health provider in the same area as the primary care provider, and they can meet and confer and maybe see somebody that same day. So.
To find out more about what you do, people can contact you on your website?
Yes, www.lifelongmedical.org.
Okay. Well, thank you, Roberta, for coming in and talking about Lifelong Medical. Sounds fascinating what you're doing and helping a lot of people.
It is. It's a wonderful organization. Thanks for having me.
Yes. And thank you for joining us for another edition of Comcast Newsmakers, and I hope you'll stop by again next time. Bye-bye.